The older we get, the more frequent we get cancer. Cancer will become the leading cause of death.
The amount of patients, it's increasing, of course, because of the aging of the population. There is a lot of challenges, but also a lot of possibilities.
Today, 1 in 8 women will develop over her lifetime breast cancer.
I wish the system just would realize that we aren't one size fits all when it comes to breast cancer.
We talk about 125,000 people in Europe who die every year of breast cancer. If we look at survival rate, the differences between several countries in Europe is just too big. You have countries where you have a survival rate after 5 years of over 90%, and still we have some countries about 60%.
In the field of drug treatment, I think we have essentially failed with the mission of personalizing the treatment.
My name is Tanya. I'm Patricia's daughter. I'm 26, so I'm a recent breast cancer survivor. I did feel packaged up, from the get-go. Read these booklets, turn up at this time, and this was your plan. I felt like a number.
I'd have chemo and radiotherapy. That's all I was told. Just get on with it. Well, you do feel like you're a number.
Talking to the oncologist was easier because she had a bit more empathy for her patient, and I could ask her personal questions.
In the modern environment, patients are much better informed. They have to be at the centre of decision-making and not have a treatment foisted upon them without them fully being involved.
There's a huge overtreatment for a lot of patients who are cured with less treatment. And I think the solution is precision medicine.
We need to combine primary care, secondary care, and tertiary care so that the GP is also in contact with the specialist so that everything fits well together in a holistic view. By taking care of the process, you will take care of the result.
If you're a patient with breast cancer, you don't just want to delay your progression by a number of months or live days, weeks, months, or years longer. You just don't want to die of this disease. We need to connect and collaborate. Patients can't wait for us to spend years in a lab and trying to optimize the treatment. They want better treatments now.
When Tanya was diagnosed, if I could have taken her cancer, I would.
There's a list that goes through your head. Why? Why me? Why now? But in a way, I think it's been easier to do it together. There's someone there. And to have it as someone that you're so close to. It's made it a lot easier. But we're here, Mom. So, we're here.
Keep fighting.
Yeah.
One of the major lessons that we have learned from breast cancer is the power of the patient voice. We now have a lot of women affected by breast cancer who've been very proud to speak out about their experience. And I would love to see that in many other cancers as well. No matter what type of cancer you have, you should be proud as a survivor to talk about your journey and your insights about how the treatment pathway can be improved.
There's no doubt there's overtreatment in many areas of healthcare, particularly in cancer. And personalised healthcare is the future. Most of the drugs coming on the market now, most of the new therapies are targeted to particular tumours, particular types of patients. And there's no doubt that will not only deliver a better result for the patient, but will be much more cost effective.
We have to learn more about this interaction between the cancer and the host. And this on a personalized level. If we do so, I'm sure we will cure more cancers with less treatment. And so at the end, it will be also less expensive.
The mental health system is ahead of breast cancer in being user-led. Mental health service users can put together a package of what they may need, and it'll be different for every service user. Wouldn't it be great if we could do the same with breast cancer?
I'm very excited to currently work in the healthcare industry because so much is happening. The digitization, the amount of information, the amount of basic research which is generated every day, I truly believe it will make an inroad in the treatment of breast cancers, but there's so much more to do.
We cannot say that the progress due to immunotherapy is impressive, but I'm confident that with more research into that area, we are going to find a way to make the immune system work against this disease.
I think we also see the big win. A lot of great researchers are working all the time for new treatments, for combining treatments. A very important message to a lot of patients, there is hope.
It's time for revolution. We have to change our own mindset from the treatments that one size fits for all to the personalized medicine. That is the future.